Welcome to the Mind Myself podcast. I'm Esther, and it is my pleasure to be bringing you information about healthcare approaches, health issues, and people's health journey stories, all from the complementary, holistic, and integrative perspectives, helping you become your own best health advocate and helping you make your own informed choices because you matter. So welcome back to part 2 of our thyroid podcast series here with Doc Jetta. Welcome, Doc Jetta.
Hi, Esther. It's great to be back.
Thank you. It's great to have you with us always. So remind us what your credentials are. You're Doctor of Chinese Medicine. What does that mean? And then we'll jump right into our discussion about the second part of our thyroid talk.
Okay. So I'm a doctor of traditional Chinese medicine. And in British Columbia, we have 3 designations for Chinese medicine: the acupuncturist, herbalist. And if you're an acupuncturist and an herbalist, you become a traditional Chinese medicine practitioner. And then there's a third licensing exam called a doctorate. And then you become a doctor of traditional Chinese medicine when you pass that licensing exam.
Great. Thank you. And I'm sure we've had many conversations, and I'm sure you deal with thyroid issues a lot in your practice. So let's do a quick recap from our session 1. What is the purpose of the thyroid? What does it do, and how does it work?
So the purpose of the thyroid is to regulate our metabolism. It's part of our endocrine system. So thyroid is a hormone that runs through our body. And it helps us regulate body temperature and regulate how quickly or slowly we burn fuel, cell division, cell growth. And like I mentioned before, I like to think of it like it's the thermostat in our body.
Mm-hmm.
Yeah.
Fantastic. And so how does it actually work for us?
Well, our body the endocrine system works on feedback. So if the pituitary gland gives the thyroid stimulation, which is the thyroid stimulating hormone, based on what the body's asking the pituitary gland to do. So if the thyroid is working optimally, then it's kind of just giving feedback to the pituitary gland saying, hey, we just need a regular amount of thyroid to keep going. Sometimes if we're working harder or it's colder out, we might need a little bit more. If it's warmer out, we might need a little bit less. If it regulates just the way, like I said, the thermostat does. If things get a little chilly, the thermostat says, hey, we need a little bit more warmth in here. So the thyroid is responding to what our feedback loop is asking for in terms of how much hormone to dump into the bloodstream.
Got it.
Yeah.
So why do you think, and this might be a difficult question to answer, but why do you think there are so many issues, particularly among women, with thyroid right now? What is that? What's going on?
Well, I think it is a bit difficult to answer in some ways. I think that it can be related to, a lot of it is related to stress. And stress could be emotional stress, physical stress. It could be lack of sleep stress, being overworked. I think being overworked is a huge part of it. Just timelines and just having so much to accomplish and so little downtime, and then how that affects sleep. The thyroid is really volatile when it comes to hormone regulation. So with pregnancy changes hormones. So then the thyroid can react to that. Menopause changes hormones, puberty changes hormones. Ups and downs in cortisol can change how the thyroid reacts and responds.
So all of those things and probably lots more, right?
Yeah, nutritional deficiencies. Yeah.
Right. And what would you recommend that people look for? How will we know if we have issues with our thyroid, what to look for?
So in Western medicine, they'll do what's called the TSH test, or a thyroid stimulating hormone, which is the hormone that the pituitary gland releases. So it's basically what our body is asking the pituitary gland to do. And that sometimes can not be the best test, but it's kind of the first protocol that's used in Western medicine to test. We can do things like testing T3, T4, reverse T3. It used to be that they would test cholesterol, and I think cholesterol still can be a valuable test to do. But when it comes to what I do, because I'm doing traditional Chinese medicine, and 3,000 years ago, we didn't have lab tests and blood tests. We're looking more at symptoms. I'm not necessarily looking for, so coming from a Chinese medicine point of view, I'm looking for patterns in Chinese medicine rather than patterns of Western medicine. But because thyroid can be such a huge part of what we're treating with fertility and women's health and hormone balance, menopause, it's good for me just to know a lot about how the thyroid functions. And you can see groups of symptoms that come together in someone and then go, oh, it looks like the thyroid is struggling.
And what are some of those symptoms?
So a lot of the things we look for are things like unexpected weight gain or weight loss, energy issues. And often what you're looking for is things that kind of come on suddenly or wax and wane. So you'll get people who maybe just sometimes they're not sleeping well, or they sleep really deeply, but they're never feeling refreshed. Sometimes you'll see goiters or a little bit of swelling in the neck. Puffy, people get a little bit puffy, digestive changes, appetite changes, memory, hair loss. So there's quite a lot, because it is affecting how our body metabolizes and how quickly it metabolizes, cell growth, cell division. It does affect a lot of the systems in our body. Yeah.
And what kinds of treatments are there available? And I know that you also look at the Western medicine lab tests, as well as your Chinese medicine treatments. But so it gives you like a more complete picture. But what kinds of treatments do you recommend?
And it depends on what the goal is and how long the person's been suffering, what their lab numbers are. When I'm working with someone who's maybe an advanced age and they're wanting to get pregnant, sometimes I'll say, you know what, just take the Synthroid or the desiccated thyroid, and we'll work with your body, trying to get your body back in balance. But if they're, if I'm working with somebody that's coming up to 40 and they want to have a baby, I'm like, just get on the thyroid medication right away. Sometimes I depending on how bad things are, I'll suggest that anyway. There are specific supplements that can be used to support the thyroid. The thyroid likes things like iodine and selenium, and in from a Chinese medicine point of view, we're actually looking at the pattern that the person is exhibiting and treating that with Chinese herbs. So it's not always necessarily one specific Chinese herbal formula or one Chinese herb that I'm using, but it's more directed at the individual rather than their lab result. But sometimes I'll have somebody taking a few different supplements to support them while we're working through, like coming at it from more than one position. Yeah. I also do some work with microcurrent over the thyroid, as well as cold laser. So I use cold laser over the thyroid as well to help stimulate it. And then acupuncture, we use acupuncture as well. Yeah.
So from your perspective, is it possible to get off, say, Synthroid or desiccated thyroid and heal your thyroid so it's functioning properly?
A lot of my patients have gotten off. It's never
Awesome.
so if I have a patient come to me and they're taking a certain dosage of, let's say they have their thyroid is low and they're taking a specific dosage, I never tell people just come off your thyroid medication. It's more about let's stick with the regime you're doing in terms of thyroid medication. Let's start working on building your health and building the health of your thyroid, and
Right.
then your thyroid's going to tell us when it's time to start weaning off the medication.
Oh, that's fantastic.
Unfortunately, I have had some patients not listen to me and just come off the medication. And luckily that the particular patient I'm thinking of did really well, but it's not a good idea just to come off of it.
Right.
Yeah.
Wow, that's exciting, because I've heard from one of my allopathic medical professionals, and she said, well, if you ever got off your desiccated thyroid, you would be a poster child, because I've never heard of anybody doing so. So this is fantastic.
We should introduce some people to each other. But like that said, there's no guarantee. And it also depends how long you've been taking it. Because if you've been taking it for a certain, it's like when your thyroid gland has to do certain work. And if you're taking a medication that does the work for it, it starts to get lazy and it starts to forget how to do the work. So everybody's different, but if you've been taking it for years and years, the chances of coming off of it are definitely reduced. But I also have people who take thyroid medication and they're still never feel like they did before their thyroid went wonky. And so there's some management there that can happen even on the thyroid medication. And
fantastic.
And often those are the patients that I'm working with the most. It's like, it doesn't feel like my thyroid medication is working and I need help with my energy or my memory or my weight gain or that type of thing.
Well, that's fantastic. You and I need to have some more conversation about this. We could talk forever, but today we have a very short period of time. So just to wrap up, Doc Jetta, what would you like to leave people with? What kind of encouragement or message would you like to say to people about their thyroids?
Well, I think I mentioned before that a lot of the Western testing isn't perfect. Like it's not, I mean, sometimes the lab test can be great for certain things. For the thyroid, it's not always so great because the thyroid tends to wax and wane. And so if you hit it at the point when it's just not doing well, then, your lab test might come back high or low or whatever. But for the most part, we're looking at symptoms. And we're looking at symptoms over time and how the body's feeling. And I mean, coming from a Chinese medicine perspective, that's what we're doing anyways. We're looking at symptoms and looking at the tongue and taking the pulse.
Right.
So I think a lot of women feel like there's nowhere to go and that why does it look like my thyroid is functioning well? Even people will get on say Synthroid and it's like, oh yeah, your numbers are perfect. And they'll be like, but I don't feel any better. So so
there are other options, and people could reach out to you or some other doctor of Chinese medicine, and there is hope.
Right.
That's what I'm hearing from you, is there is hope.
There is hope.
All right. Well, we'll leave the contact information for you, Doc Jetta, below. And if people have some more questions or want to set up an appointment with you to talk about thyroid or any other issues, they can do so after this. So Thank you again. Thank you,
Esther.
Thank you for being with us at the Mind Myself podcast today. We know that time is precious and you've spent some of your valuable time with us. We're grateful. If you would like to reach out to our guest directly, the information is below. And if you would like more from Mind Myself, that information is also below. Please visit our website and check out all the information about the different complementary, holistic, and integrative healthcare approaches, information about health issues, more podcasts, tons of blogs, and we even have a community page for you where you could reach out and tell your story safely, or you could ask questions and perhaps somebody else in the world is going through something similar to you. In any case, we're so glad you're with us, and we're doing this because you matter.